Hello, this is peer checkoff number 1. First, I'm going to check in the patient's chart here. Okay. Hello, Miss Olivia. My name is Trisha. I'm with Respiratory Care. It looks like the doctor has ordered some medications for you. Kind of sounds like you're having some shortness of breath. Little difficulty breathing, would you say?
Yeah.
Okay. So here's some medication. The first medication we're going to do is called albuterol, and it is just a medication that you inhale. When we get this all set up here, breathe normally for me. Now we take a couple deep breaths here and there, but before we do that, I'm just going to get some vital signs here. First, I'm going to take a listen to your lungs. So I want you to take some nice easy breaths for me. Good. Listen in the front. Good. And then listen on the side here. Good. Very good. Okay. Yeah. Sounds like you have a little bit of wheezing going on in those lungs there. How are we doing now as far as breathing? Feeling okay so far?
Mm-hmm.
Okay. Just take your pulse beforehand as well. And then I'm going to put this little device here on your finger, and we're going to get your oxygen level within your blood. We always do that before and after as well. Check it out. Okay. So we'll get this albuterol set up. Have you ever done any breathing treatments in the past?
No.
So with this one, like I said, it's just an inhaled medication. Goes into the lungs, and it's supposed to open those lungs up so that you have called bronchodilation, so you have a little bit easier time breathing. We don't have much of that wheeze. Hopefully it will take care of that, okay? So I will give you this, and like I said, you just breathe normal. Couple deep breaths, every 2 to 3 breaths or so, you take a big deep breath in of that medication, okay? Okay, go ahead and start that. Okay, so after a 10-minute time frame, we'll be done with that one. So that we're finished with that one. So now I'm going to have you take a deep breath in, big breath out. And now I'm going to have you cough. Try and cough any of that stuff up. Very good. Do you feel like you're breathing any better now?
Mm-hmm.
That medication helped a little bit. Okay, I'm going to take a listen to your lungs again. Good. Very good. You sound a little bit clearer, so that's good. Just going to check your pulse again here. Good, and then check that oxygen level again. Good, and that's improved too. Heart rate has come up a little bit, but I'll talk to the doctor about that. And we just don't want the heart rate coming up too much when we do these treatments, so I'll talk to the doctor about that just to make sure that he's aware and we want to continue on with these treatments. The other thing I'm going to have you do right now is I'm going to have you do what we call a maintenance treatment. The one that we just did has a little bit shorter acting, and it lasts a little bit, 5 to 8 hours or so, whereas this one is more for maintenance. So this shorter acting, you were wheezing, have a little bit of difficulty breathing, this will clear that quicker. The longer acting, this is called Ceravent, we're going to give this to you, and this is going to last a maintenance dose. So we're going to have about 12 hours or so of relief. So you can use this one twice a day. With this one here, we'll do this one about 4 times a day, sometimes 3 times a day, but typically 4 times a day, kind of to keep on top of that wheezing. This one we're going to use to prolong that your lungs stay open longer for what we call a maintenance dose. So with this one, we have a little lever. See, there's a mouthpiece here, lever here. We're going to click down, and you'll hear a click. And then once that has clicked, that means it's opened up and it's ready to go. Have you take a big breath out away from your inhaler, then seal your mouth around this little mouthpiece here. Breathe in really slow and deep for me. Get that medication down into those lungs, okay? And then you hold your breath for 10 seconds. And then when you breathe out, move that inhaler away and breathe away from the inhaler for me. So I'll have you do that right now. Big breath out away from the inhaler. And then seal your mouth around that mouthpiece. Inhale, long and slow. Hold your breath for 10 seconds. And then we'll move it away and take a breath out. Okay, you did a very good job with that one. With these treatments too, I'll have you, every time you're done using those treatments, we'll rinse your mouth out and spit it out so we get all that medication rinsed out. There are some medications that they may change up on you, called a corticosteroid, but if we take those, it'll leave a residue in your mouth and it could cause thrush, so we'll rinse that away, okay? Any questions with this one? Okay. Third thing we're gonna have you do, so we've got your short term for when you're having issues breathing, your long term to maintain that. Then we're also going to give you one we call a rescue inhaler. So say you're out playing a softball game, having wheezing, short of breath, you can't get to this medication, this is what we're going to have you use, that rescue inhaler. This delivers the same medication, albuterol. L-Nate's in this little form so you can carry this around with you. We can use 2 puffs of this about 4 times a day, okay, or every 4 to 6 hours. We don't want to take it too much. So with this one, this is a little holding device, holds the medication in there, makes it easier to breathe in. We'll take off the cap for this one, put that right into the holding device, and then with this, we'll open this mouthpiece here. This seems to happen when I put these together. We would do it the correct way, there we go. Okay, so with this one, we're gonna push down, that'll fill the medication. Same time you're pushing down, take a big breath in. But before we do that, I want you to blow all the air out that you can in your lungs. Then you're going to seal this around your mouth here. Press down, big breath in while you're pressing down. Once again, pull it away from your mouth and then breathe out, okay? Go ahead and big breath out. Seal it around your mouth. Press as you're breathing in. Hold for 10 seconds. And then breathe out. Very good. So then, like I said, we would do 2 puffs of this. With this, you're going to want to wait about a minute or so in between those puffs. You want to get that medicine pushed down into those lungs. Wait a minute. Do it again to get more medication even further down into those lungs. All right. Do you have any questions for me? Okay. So, like I said, with that first initial one, that's about every 4 hours we're going to do that. So you'll see me again in 4 hours. If you have any questions before that, please let us know. Is there anything I can get for you right now before I leave the room? Okay. Thank you, Miss Olivia.